There's been a possible breakthrough in detecting a potentially deadly condition affecting pregnant women. 1 in 20 expectant mothers in Australia suffer preeclampsia, with some women forced to end their pregnancy, while it's also blamed for bringing on labour early and an increased chance of caesareans. Now, researchers have found there could be a genetic link between unborn babies and preeclampsia in mums. So for more, let's bring in our resident doctor, Tamara Hunter. Hi there, Dr. Tamara Hunter.
Hi, Amy.
Now, firstly, it's a common condition. I know I've suffered from this myself, but researchers say they still don't know about how it's caused.
That's right. Preeclampsia is a disorder of high blood pressure in pregnancy, and as you pointed out, is responsible for complications both in the mother and also in the baby. So it's really important for us to manage in pregnancy. For years, researchers have been looking at biomarkers, blood chemicals and their receptors and how they're upregulated, particularly in the context of placental markers. And now there's the suggestion that there's a certain genetic profile within an unborn child that increases the chances of their mother getting preeclampsia. Now, it's early days yet in this research. Much more needs to be done, but this may be something along the pathway to unlocking the causes of preeclampsia and maybe help us to detect it early in pregnancy.
Now, this new research suggests preeclampsia is more of a nature versus nurture condition.
Well, it's actually multifactorial. Yes, we know that women who have a family history of preeclampsia and a personal history of preeclampsia are more at risk of getting preeclampsia, but there are lifestyle things. We know that women who have other medical disorders, diabetes, renal disorders, can increase their chances. Women who are overweight or obese leading into pregnancy, even women who are much older, having their first child or perhaps carrying a twin pregnancy, puts them at higher risk of preeclampsia.
So what are some of these symptoms expectant mothers should look out for?
Preeclampsia manifests itself after the 20th week of pregnancy, and some women just simply show up to their antenatal appointment, have a high blood pressure and protein in their urine, and that's the diagnosis of preeclampsia. But there are symptoms to look out for: persistent headaches, blurred vision, spots in front of the eyes, perhaps increased swelling in the hands and feet or acute weight gain, and progressively it can even become sort of epigastric and chest pain, which is a sign of severe preeclampsia. So those symptoms shouldn't be ignored.
So if it happens during your first pregnancy, if you suffer from preeclampsia, how likely is it to happen again in subsequent pregnancies?
Well, there's no absolute guarantee, Emmy, but certainly if a woman has had it in a previous pregnancy, we keep a much closer eye on her in her subsequent pregnancy for developing preeclampsia.
And is there anything that can be done during pregnancy to perhaps lower the risk?
Look, it's a process of detecting the disease early, so it's important that you attend your antenatal appointments, take the advice about lifestyle, watch weight gain, reduce the chances of getting gestational diabetes by managing diet and exercise, and of course if you manifest those symptoms, presenting to a doctor or your midwife early for discussion.
Okay, thanks for the advice, Dr. Tamara Hunter. Thanks for coming in too, and have a great weekend.
You too.